My name is Captain Susan Stankorb, and I'm currently serving as a dietitian in the U.S. Army. I've been serving in the U.S. Army since 2003, and I'm currently stationed at Brooke Army Medical Center, San Antonio, Texas. Since serving in the military, I started out at Brooke Army Medical Center in 2003 as a dietetic intern. After I completed my internship, I was stationed at Fort Leonard Wood, Missouri, a small Army community hospital on the post of Fort Leonard Wood. While assigned there, I was the Chief of Clinical Nutrition, as well as outpatient and community nutrition services for the post. After being assigned at Fort Leonard Wood, Missouri, I deployed with the 28th Combat Support Hospital to Baghdad, Iraq in 2005 and returned home in 2006. While stationed in Iraq, I was responsible for caring for wounded soldiers and civilians, operating a large dining facility and patient feeding services for the hospital, as well as advising the command on any nutrition-related issues that came up in the theater of operations. After I came back, I was assigned to the U.S. Military Baylor Graduate Program in Nutrition as their clinical instructor, and I served there for 3 years, after which I got my doctorate in nutrition at SHRP, and now I'm currently serving as the Director of Nutrition Research at Brooke Army Medical Center. Serving in the U.S. military is the highest honor I could possibly imagine. There's nothing I would rather do than put this uniform on every single day. Being able to work with soldiers to keep them fit and our force optimized, as well as treat those who are wounded in battle and help them return to their optimal function, is an absolute dream to get to do every single day. So my academic background, I actually completed both my master's in nutrition as well as my doctorate in clinical nutrition at SHRP. I began my master's in clinical nutrition while I was deployed to Iraq, and that's one of the best things about the program because it does allow for a distance-based option. I was able to work on my schoolwork and my master's while being deployed, and being able to do that was a real blessing. Number one, because it provided me a distraction from my day-to-day stress, but it also helped me become the strongest clinician I could be and gain the critical thinking skills that I needed to serve in that environment where you're not necessarily going to find the answers that you need in a textbook. And then I went on to get my doctorate in clinical nutrition almost immediately following finishing my master's degree. And earning that degree has opened up a lot of opportunities for me to serve within the military, particularly serve in designing and executing much needed research to improve the care for our wounded warriors. And this is important because no one else in the world besides us in the military healthcare profession can do this research to meet our unique and specific needs. So my SHRP memories are somewhat few, being a distance-based learning student and not having much time on the actual physical campus of SHRP. However, what I do remember most from my coursework are the connections that I made with my fellow classmates. So despite being a distance-based learning program, I now have a very large network of dietitians with very unique and differing skill sets that I can reach out to and access and ask for their help. And that network has served me very well in the military and professionally, and every time that I get to go to a national conference, I still get to see and interact with these people. And it's interesting because sometimes I'll be meeting them for the first time in person, but there's definitely still a bond there just from the time spent in the program together and working in that electronic kind of environment. So SHRP means a great deal to me because going through the education that I had there expanded my knowledge base so much, and it's opened up so many fantastic opportunities for me not only in the military, but within the dietetics profession. And so my time spent there was really worthwhile, and the university and SHRP, as well as the Department of Clinical Nutrition, really holds a special place for me, and I still interact with the faculty of the Department of Nutrition regularly, and they've become fantastic mentors for me, both personally and professionally. So being a health professional, it is my chosen profession, and after 10 years of being a dietitian, I have not regretted that decision once. And the primary reason for that is the reward of being in a profession where you get to help people, and especially helping people sometimes when they're really at the lowest point in their life, and getting to help them in that process of reaching their goals and improving their quality of life through the nutrition medicine that you provide is extremely powerful, and it gives you a fantastic sense of accomplishment at the end of every day.